do, but they are trying their very best to say. Now they are promising to go to 2.5%. So I think the financial burden is one side, because the family, as far as the family is concerned, the members present, the family member is more important. I think this is a big thing that we all need to do. Can we create whatever we have done in the 60,000 people for the 6 billion people? Can we ask this question? I'm asking the press to say, project this and say, if we can do miracle, inventing newer weapon, you must invent this weapon which can cure your health. I'm very confident that it can be done, and I think the world leaders, people must think, saying, my priority is my health. I think that once that gets in, unfortunately, priority is health sometimes. They do a lot of exercises, they do all of this, but they don't understand that. So what we have created is the word called Pro Health, is out of the 22 million health checkups that are done, thanks to the artificial intelligence, they have brought in a checkup which is individualized, personalized checkup, and a permanent record. Your record forever will be Apollo 24 and 7 at any time that you want. I think this is where the Pro Health will make a significant impact in the first that we want to stay healthy. All my one single word is stay healthy. And the World Health Day, take that challenge, saying I can stay healthy, I don't have to severe consequences of diabetes or hypertension and or cholesterol or any of these risk factors, but I will stay healthy. But you will go ahead, finding out your state of health, and then say, these are the various things that I will do to stay healthy. God bless you all. I love you all.
Thank you. Thank you very much, Chairman, sir. Your kind words and quite a few insights on the World Health Day. Thank you, Dr. Sangeeta, and all the speakers who've been sharing some interesting data with all of us. I would now request a short AV to be played before we get into the Q&A session. Can we have the AV, please?
We at Crossroads. The fight against non-communicable diseases is the greatest health challenge we face today. Almost all of us know someone who has suffered or died from heart disease, cancer, lung disease, or diabetes. Non-communicable diseases kill more people than any other cause of deaths worldwide. This includes 6 million people who die each year in their most productive years, with vast majority of them being premature deaths. It's time to drive ourselves to make critical choices. Do we take the road to a healthy future by improving detection and screening for conditions like cancer, heart disease and other ailments, and providing health care for all and ensuring people are well enough to work and support their families and communities? Or do we continue down the same imprudent path? Despite the fact that these diseases are preventable, the number of NCD-attributed deaths are increasing, and increasing everywhere as demographic changes offset the decline in NCD mortality rates. This trend cuts across all income groups, globally from low-income countries to wealthier nations. We are enduring and living through extraordinary times. The global outbreak of COVID had an adverse effect on our work towards a healthier world. More so, it has made a definitive assault on the vulnerable NCD population, engendering enormous fatalities. And Apollo, being the vanguard of healthcare advancement, has taken this crisis head-on. It has taken the pledge to not only treat but to decimate NCDs. With the experience of over 22 million health check over 4 decades, Apollo has redefined the preventive management with Apollo Pro Health, a unique AI-enabled personalized health management program to combat the tsunami of NCDs. Using latest technology in biochemical, radiology, genetics and analytics enables us to predict risk of somebody becoming sick. Early warning symptoms, lifestyle modification, appropriate medication helps understand the risk factors and prevent them. Personalized paths to wellness aid to overcome small problems swelling into bigger issues. At Apollo, we are working towards envisioning a world where cancer is only a birth sign. Blood pressure is only read as beautiful people. Sugar levels are seen only in kitchen jars. Stroke only in cricket matches. Imagine a world where fat burns faster, where calories are never counted, and age is only a self-limiting physical quantifier. This is the world free of NCDs that we have envisioned with Apollo Pro Health.
Thank you very much. We will now open forum for the Q&A session. I would request the media to raise their hands so that we can line up the questions. In case you're not able to, for some reason not ask the question, you could type that in the chat box. Sure. We have Mr. Baleshwar. Sir, go ahead and ask the question, please. Baleshwar, are you able to ask the question?
Yes, sir. First of all, I appreciate this program, very useful. And my question to Chairman, Dr. P.C. Reddy, sir, is that, he said cancer, early prediction of cancer is curable. Yes, right, is what is been widely said about. But as an hospital, it's been for the last 4 decades, what is your testing, procedure for cancer in your regular general health checkup? What you are currently following that? Or do you have any other specific checkup for cancer prediction earlier? Because detected in earlier stage, certainly the patient will come forward. The biggest problem with cancer patients are that they are getting symptoms and, only after they come to the second or third stage and then they come to the doctor. And the doctor says, yeah, you're third or fourth stage, so may not be curable and all that. So can you please put a here, something for our people to understand, for us to also take it forward to the at last.
Thank you very much. I think it's a wonderful question. It answers the entire gamut of cancer. First, let me say, I use the word saying, cancers are detected early. What we call early stage 1, stage 2 is curable. But what the patients look Dr. Apollo most often is stage 3, stage 4, when all the gamuts of therapy that we have to use them and perhaps save them. But as I said, if they undergo the checkup, or sometimes they detect themselves, so not the ladies what's called the self-examination. During the self-examination, they feel that their tumor, if they come to us, it's a very simple procedure. To remove the tumor before it has spread to other place, makes her live a normal life. So I think in almost all cancers, we concentrate when we do this Pro Health. So we take Apollo Health Check, today it's called Pro Health. In Pro Health, the doctor and the investigations are all geared to see that if they have cancer, whatever stage it is diagnosed. If they are diagnosed in stage 1, stage 2, the cure is 100%. If the diagnosed stage is therefore, Yes, we have all these chemotherapy, including one of the world's best proton therapy centers. So that is needed only for stage 3, stage 4 patients. But your question is, if everybody is aware, and if they go for preventive health checkup, and certainly all of them can be detected first. There are diabetes which is detected, the control is mechanism is stored, and if you follow, that will not hurt the body. Because diabetes bites from head to foot. Similarly, the hypertension is very clearly shown, the hypertension and diabetes and diabetes. All of them, people who did not know diabetes, when went to the checkup, they found out diabetes and hypertension. In the real control, the complications of cerebral hemorrhage, heart attack, and stroke, none of these will happen. I think that is a good question. Please advise everybody to be conscious of that, because you have a very precious body. I am very fond of saying this. It's not my quote. One of the persons from New Haven, he said, each one of our body costs $6,000 trillion. Please remember this. If you have a body which is $6,000 trillion, you have a car which is 6 lakhs of rupees, you service it regularly. But I think 6,000 trillion body needs a checkup once a year. And this ProHealth is something that not only detects your problem, also gives you a health record for life.
Thank you, Chairman sir. We have Mr. E. Kumar. Sir, you can go ahead and ask the question. So, are you able to ask the question, Mr. E. Kumar?
Yeah, I hope I'm audible now.
Yeah. Yes.
Yeah, see, very important. Thanks, I think, for brilliant presentations actually. But as you noticed, actually, this NCDs, we've known for a long time that 60% of all deaths in India have been generally around 60% due to NCDs. I just want to check in the context, we are in terribly very challenging times. So how has the last year's pandemic played a role? How is yours, since you've done a study, how has the increase in NCDs happened during the pandemic, and the current round, which is a rather vicious round now, how is that playing out, at least your early findings of what's happening? And second point is actually, how do you see the impact of this now going forward? Because the staff, the infrastructure has its own, it's thinly spread. So you have COVID beds as well, so you'll have to redeploy. Footfalls will apparently also fall. So how much of an impact on NCDs as a result of what's happening currently is expected? And finally, which is saying what you have said in mind in terms of ProHealth, great initiative. How much do you expect in a year from now? Let's say, what's the goal in terms of where do you want to get to? 3 points.
Anupam, would you like to take the question on COVID and NCD?
Oh, sure. Thank you for that. It's a very important point that you raised, and this is something that we struggle with every week. We've seen individuals with cancer where they were scared to come to a hospital with COVID and a lump was ignored, and if that lump had been picked up and Dr. Reddy said corrective surgery initiated, we wouldn't have had the spread that we have at presentation. We've seen that with cancer, we've seen that with heart disease, we've seen glycosylated hemoglobin increase because the sugar checkups didn't happen in diabetics. We've seen patients with hypertension not get their checkup done, and which has resulted in a stroke. So what has happened is that non-communicable diseases, which really are so important, because of fear of COVID and because of the apprehensions that people have had, and I have to take this opportunity to reassure everyone that hospitals such as Apollo Hospital have an iron curtain between COVID and non-COVID. There is no crosstalk. There is no question of even crossing paths when you are in hospital. So this fear is unfounded, but unfortunately because of this fear, we have seen that NCDs have taken a backseat, and we are seeing serious consequences of the NCDs being neglected, which is really worrying us. We saw this happen last year, but then when the COVID numbers started to decrease, patients got the confidence, and we hope that patients continue to have that confidence that their health is supreme, this life is priceless. It is hard to put a number in terms of a percentage we would be able to quantify in terms of NCD being neglected. But one thing is very clear, we see this every day across our entire ecosystem of conditions that we should have managed 6 months ago coming to us now.
So no estimate in terms of how is the pandemic impacted NCDs? We
Well,
are
I can
18 months into it.
I can just say that the numbers have increased considerably, but you would have to do this on a population-based study to actually look at, as the data we shared with you about 1.5 million that we have reviewed over the years, and we see 17%, 12%, 13%, 18%, 32%, and diabetes are up to 35%. So because of the COVID, to hold COVID responsible for a particular percentage would be really difficult to quantify. But what we can definitely tell you from on the ground, that the numbers of those who should have come to us early and have come to us now, and that has increased considerably, and that's the worry, and that's the message that we want, hopefully through your good offices, to be disseminated, that please do not ignore your health needs.
Thank you, Dr. Subul. The next question is a couple of questions from the journalists about ProHealth. So, is the program live? That's the first question. And how can they enroll in it?